Let's talk about diabetes.
Another great example, the way we're trying to treat type 2 diabetes in this country is almost criminal. Type 2 diabetes, in most cases, owes its origin to diet and lifestyle. And we're trying to counteract those diet and lifestyle problems by taking these little pills. It's a little bit like this. If I hurt my arm, I may need to put it in a sling to allow it to heal. But what would happen to my arm if I left it in that sling? It's going to wither and atrophy. And that's what these drugs do to our physiology. Studies over 40 years ago showed that when people took these little pills to try and lower their blood sugar levels, that they actually increased their risk of having a heart attack. These newer drugs are no better. There was a drug that was launched to great aplomb. It was going to be the answer to type 2 diabetes, a drug called Avandia. When they finally got around to doing a study that was unbiased, they compared the group that got Avandia to a placebo, and what they found was that Avandia increased the number of heart attacks by 64%. Now, having a fatal heart attack is the #1 killer of people with diabetes. So the Avandia was putting people into the grave quicker. So it's not the best approach. The best approach is to address the underlying cause, and the most common underlying cause is increased abdominal obesity.
Okay, well, let's talk about obesity. It's an epidemic.
It is an epidemic. 8 out of 10 people over the age of 25 are overweight or are medically obese. 38% of Americans meet the medical definition of obesity. It's gotten out of control. The reason is that when we eat in excess and start gaining weight around our abdomen, that these fat cells collectively start acting like a tumor. And what do tumors want to do? They want to grow. So how do these fat cells grow? They grow by secreting compounds that block the action of insulin. That leads to insulin resistance. We have specialized brain cells that are responsible for monitoring our food intake. When they become insulin resistant, insulin works by binding to receptors on our cells and opening up channels that allow nutrients to get into that cell. So in the brain cell, when it becomes insulin resistant, inside there's a relative nutritional deficiency. So the brain thinks it's starving. So what's it going to do? It's going to stimulate people to eat. It's going to particularly stimulate them to eat foods that are going to quickly raise their blood sugar levels. And that's why people that, when they start gaining weight, it's a snowball. And if they try to diet, they end up gaining more weight than they had before they went on a diet. According to the National Institute of Health, over 90% of people that go on a diet end up gaining weight at the end of 5 years. So that's not the way to get effective permanent weight loss.
Well, I know that in America there's kind of a popular thing happening now, and that I should feel good about my weight, even if I'm overweight. I mean, can you be healthy and fat?
Very difficult. I think there are ways you can be healthier if you're overweight, but if you're overweight, it greatly stresses your physiology, your body processes. And obesity has now overtook smoking as a #1 killer in America, #1 cause of preventable illness. With Dr. Michael Lyon, I developed a program called the Hunger Free Forever program. We have a book called Hunger Free Forever, and what Dr. Lyon discovered by monitoring blood sugar levels over a 24-hour period is that most people with obesity or who are overweight are on what we call a blood sugar roller coaster. Insulin works in our body by opening up channels and allowing nutrients to enter that cell. So when you develop insulin resistance, inside that cell there's a relative insufficiency of nutrition. We have specialized brain cells that monitor our food intake. When we develop insulin resistance, that brain cell thinks it's starving. So what it does is it mobilizes us to eat foods that are going to quickly raise our blood sugar levels. And that starts what we call the blood sugar roller coaster. So what Dr. Lyon did was monitor people's blood sugar levels from a 24-hour period, midnight to midnight. So this graph represents taking a movie picture of a person's blood sugar control. And what we found is that people that are overweight are on this blood sugar roller coaster. When you have this high degree of blood sugar volatility, it's very difficult to control your appetite. Your metabolism starts to slow down. You can't maintain your energy levels or your mental focus. We can take people with this blood sugar roller coaster, put them on our program, and literally flatline their blood sugar levels. And this approach by narrowing a person's blood sugar control is the vehicle that allows people to effectively achieve and maintain their ideal body weight. Because when you can control blood sugar within a very narrow range, then what happens is you have control of your appetite, you have increased insulin sensitivity, so your metabolism starts getting revved up, and you start burning more fat and losing weight. And our program is really results oriented. It's clinically tested. We've utilized this program in over 500 patients successfully. This program really is the real answer to help people lose weight. And there's so much noise out there about weight loss that it's hard to get heard through the noise. But our program, if people read about it and understand it, they'll understand that it's based on very good science and very good clinical evidence of efficacy and safety.
Well, let's talk about women for a minute. Most of them are concerned about osteoporosis and bone loss. Is there help for women?
Absolutely. We know enough about osteoporosis from diet, lifestyle, and supplement approach that women should never have to take any drugs to deal with osteoporosis. The drugs aren't very effective anyway. If we look at how the drug companies brought these new drugs for osteoporosis to the market, we can see that it's really more about marketing than it is about real science. One of the first drugs that was approved is a drug called Fosamax. The approval of Fosamax was based on the strength of primarily one study. That study was called the Fracture Intervention Trial. In that study, they gave women either Fosamax or a placebo. Okay. Now, these were women who had had a history of a hip fracture or who were at a very high risk for having a hip fracture. And most hip fractures are caused by osteoporosis. So they then followed these women for 4 years. In the placebo group, out of 100 women, there'd be 2 hip fractures. In the drug-treated group, there would be 1 hip fracture. So what did the drug company tell doctors? That it would reduce the risk of having a hip fracture by 50%. But that's true. But what the drug companies don't tell doctors is that you have to treat 98 women for a minimum of 4 years to prevent 1 hip fracture. Now, out of those 98 women, how many of these are going to have side effects? The side effects of these drugs are fairly well known now. When they were first launched, the side effects that they were mainly concerned about were muscle pain and muscle aches and joint pain. Then after a while, they noticed that many women were complaining of heartburn and esophageal pain, and they found that the drug was actually eating a hole in the esophagus of these women. So it came with a black box warning telling women not to lay down for 45 minutes after taking the drug. Now these drugs are linked to a condition called osteonecrosis of the jaw, which is basically these drugs don't cause normal bone formation, and the bone that's being formed is abnormal and it's more susceptible to damage, and these women are basically having these drugs eat holes in their jaws. It's not the best approach. There's things that we can do naturally that can build healthy bones. Exercise, diet, avoiding soft drinks, eating an alkaline-based diet, and then of course proper supplementation. The combined use of vitamin D and calcium alone will produce better results in prevention of osteoporosis hip fractures than the drugs. There's no question about that. That's what the research shows.
I found Chapter 6 so interesting, creating a market versus providing a cure. Obviously, this is a huge problem. Can you give us a couple of answers to this growing concern?
Well, I talked about osteoporosis. That's a very good example. If people look at the numbers for high cholesterol and high blood pressure over the last few years, they'll also see a trend. What the drug companies are trying to do is they're trying to expand their market by lowering what is considered normal. And when they do that, they make more money, and they not necessarily provide any additional benefit. There are problems with both the cholesterol-lowering drugs and the blood pressure-lowering drugs. What we have to do is use those numbers to institute more effective therapy, which I think involves using diet, lifestyle, exercise, and proper supplementation.
Thank you, Dr. Murray. We'll talk more about solutions and lifestyle changes next.